What drew you to a career in cardiac nursing?
My passion for cardiac nursing stems from a deep interest in the human heart's complexity and its central role in sustaining life. Early in my training, I was fascinated by how advancements in cardiology could dramatically improve patient outcomes, even in critical situations. This interest grew further during my clinical rotations, where I had the opportunity to witness firsthand the profound impact skilled cardiac care can have on patients and their families. What solidified my decision was an encounter with a patient who had survived a myocardial infarction. Their recovery highlighted not only the life-saving power of prompt cardiac intervention but also the importance of compassionate, holistic care in helping patients regain their confidence and quality of life. I realized that cardiac nursing offers a unique blend of technical expertise, critical thinking, and emotional connection, qualities that resonate deeply with my professional values. Additionally, I am drawn to the dynamic nature of the field. Cardiac nursing constantly challenges me to stay updated with innovations in technology and evidence-based practices, ensuring that I am always growing both personally and professionally. Above all, I find great fulfillment in knowing that my role can directly contribute to preventing disease, promoting recovery, and, ultimately, saving lives. These aspects make cardiac nursing a truly rewarding and inspiring career path for me.
Describe your experience in monitoring and managing critically ill cardiac patients.
Throughout my career, I have gained extensive experience in monitoring and managing critically ill cardiac patients in both intensive care units, ICU, and coronary care units, CCU. I have had the opportunity to care for patients experiencing a wide range of cardiac emergencies, including acute myocardial infarctions, heart failure, arrhythmias, and postoperative recovery following heart surgeries such as coronary artery bypass grafting, CABG, or valve replacements. In these high-stakes environments, I focus on continuous monitoring, ensuring that I track vital signs closely using advanced cardiac monitoring equipment. I am adept at interpreting electrocardiograms, ECGs, to detect arrhythmias or other abnormalities, and I work quickly to implement appropriate interventions, whether adjusting medication dosages or alerting the medical team for immediate action. I also closely monitor hemodynamic parameters, such as blood pressure, cardiac output, and oxygen saturation, and am skilled in titrating medications like vasopressors, inotropes, and anticoagulants to optimize patient outcomes. In addition to technical skills, I am deeply committed to providing compassionate care. I take the time to educate patients and their families about the severity of their condition, possible interventions, and the recovery process, which helps reduce anxiety and ensures that they feel supported during such critical times. My experience has also allowed me to collaborate effectively with multidisciplinary teams, including cardiologists, intensivists, respiratory therapists, and dietitians, to create personalized care plans that address both the immediate and long-term needs of critically ill cardiac patients. My role has also involved managing complex situations, such as patients in cardiogenic shock or those requiring mechanical circulatory support, where rapid decision-making and a calm, methodical approach are essential. Each case reinforces the importance of vigilance, precision, and collaboration in the care of critically ill cardiac patients, and I remain committed to continually refining my skills in this challenging but incredibly rewarding field.
How do you handle stressful situations such as cardiac arrests or code blues?
Handling stressful situations like cardiac arrests or code blues requires a combination of clinical expertise, composure, and teamwork, and I have honed these skills throughout my nursing career. During such high-pressure events, my primary focus is to stay calm and methodical to ensure the best possible outcomes for the patient. I adhere strictly to established protocols, such as Advanced Cardiovascular Life Support, ACLS, guidelines, and I am confident in performing critical tasks, including initiating chest compressions, managing airway support, and administering life-saving medications. In these scenarios, clear communication is crucial. I make it a priority to communicate effectively with the code team, whether I am leading the effort, providing updates on the patient's condition, or responding promptly to instructions. This collaborative approach ensures that everyone remains aligned and focused on the immediate goal, stabilizing the patient. While the intensity of cardiac arrests can be challenging, I draw on my training and experience to compartmentalize stress and focus solely on the task at hand. After the situation is under control, I take time to reflect on the event, participate in debriefings, and support my colleagues, as these situations can be emotionally taxing for everyone involved. I also ensure that I engage with the patient's family to provide updates and offer emotional support, as they are often in distress during these critical moments. Overall, my approach to handling stressful situations is grounded in preparation, confidence in my skills, and a deep sense of responsibility for delivering the best possible care under pressure. Each event serves as an opportunity to learn and further refine my ability to perform effectively in future emergencies.
What is your understanding of advanced cardiac life support, ACLS, and its application in the CCU?
Advanced Cardiac Life Support, ACLS, is a comprehensive set of clinical guidelines and interventions designed to manage life-threatening cardiovascular emergencies such as cardiac arrest, stroke, acute coronary syndromes, and other conditions requiring immediate intervention. My understanding of ACLS extends beyond theoretical knowledge, as I have both certification and hands-on experience applying these protocols in critical care settings, particularly in the coronary care unit, CCU. In the CCU, ACLS plays a crucial role in managing emergencies like arrhythmias, cardiac arrests, and acute myocardial infarctions. I am well versed in the algorithms for recognizing and treating these conditions, including the use of defibrillation for ventricular fibrillation or pulseless ventricular tachycardia, administering appropriate medications such as epinephrine, amiodarone, or atropine, and providing advanced airway management when necessary. A key part of ACLS application is teamwork and role allocation. During a code blue, I work collaboratively with the team, whether leading the response, performing chest compressions, managing intravenous access, or monitoring and interpreting cardiac rhythms. I am also skilled in using and troubleshooting advanced monitoring equipment, such as defibrillators and capnography, to guide and optimize resuscitative efforts. Equally important is my ability to think critically and adapt protocols to the unique circumstances of each patient, considering their underlying cardiac conditions, medication history, and overall health status. For example, in post-arrest care, I focus on stabilizing the patient, initiating therapeutic hypothermia if indicated, and preparing them for further interventions like cardiac catheterization or advanced imaging. Through regular participation in training sessions, mock codes, and continuous education, I ensure that my ACLS skills remain sharp and up to date. My goal is to provide prompt, effective, and evidence-based care to improve patient survival and recovery outcomes in the CCU.
How do you communicate effectively with patients and their families during critical times?
Effective communication with patients and their families during critical times is a cornerstone of my nursing practice. I approach these interactions with empathy, clarity, and a strong sense of responsibility to ensure they feel supported and well-informed during stressful situations. When speaking with patients, I focus on being calm and reassuring, even in high-pressure moments. I use clear and straightforward language to explain their condition, treatment options, and any immediate steps being taken. By avoiding medical jargon and checking for understanding, I help patients feel more confident and involved in their care. I also pay close attention to nonverbal cues, such as facial expressions and body language, which often reveal unspoken concerns or fears. Acknowledging these signs allows me to address their emotional needs as well as their medical ones. Communicating with families is equally important, especially during critical times when they may feel overwhelmed or powerless. I prioritize honesty and transparency, ensuring they are updated about the patient's condition, prognosis, and care plan in a sensitive and compassionate manner. For example, if a patient has undergone a cardiac arrest or is critically ill in the CCU, I explain the interventions being used and what to expect in the coming hours. I also provide space for questions and encourage them to share their concerns, making sure they feel heard and valued as part of the care process. In particularly emotional situations, such as delivering difficult news, I approach the conversation with patience and compassion, allowing the family time to process the information. If needed, I connect them with additional resources, such as counseling or chaplaincy services, to provide further support. Ultimately, my goal is to build trust and foster a sense of partnership between myself, the patient, and their family. By maintaining open, empathetic communication, I help them navigate critical times with greater understanding and confidence, even in the most challenging circumstances.
Explain your experience with administering cardiac medications and monitoring for adverse effects.
Administering cardiac medications and monitoring for adverse effects are integral aspects of my role as a cardiac nurse, and I have extensive experience managing a wide range of pharmacological therapies for critically ill patients. My knowledge encompasses both the mechanism of action and the practical administration of these medications, ensuring safe and effective care. In my daily practice, I frequently administer medications such as vasopressors, dopamine, norepinephrine, inotropes, dobutamine, antiarrhythmics, amiodarone, lidocaine, beta blockers, metoprolol, ACE inhibitors, diuretics, anticoagulants, heparin, enoxaparin, and thrombolytics. Each of these medications requires precise dosing and vigilant monitoring, particularly in critical care settings where small changes in a patient's condition can have significant implications. Monitoring for adverse effects is a priority, and I am skilled at identifying both common and rare complications. For example, when administering vasopressors, I closely monitor blood pressure and signs of tissue perfusion, as well as potential adverse effects like arrhythmias or extravasation. For anticoagulants, I monitor coagulation parameters, such as PT/INR or APTT, and remain alert for signs of bleeding or heparin-induced thrombocytopenia. Similarly, I observe for symptoms like electrolyte imbalances or hypotension when managing diuretics, and I adjust care plans in collaboration with the healthcare team if issues arise. Documentation and patient education are also critical components of my practice. I ensure that medication administration and the patient's response are thoroughly recorded, providing an accurate account for the medical team. Additionally, I educate patients and families about the purpose of prescribed medications, their potential side effects, and the importance of adherence to long-term therapies, especially after discharge. My experience with cardiac medications has taught me the importance of precision, vigilance, and proactive intervention to prevent complications and optimize patient outcomes. By combining technical proficiency with a patient-centered approach, I strive to deliver the highest standard of care.
What are the key factors to consider when assessing cardiac patients for potential complications?
Assessing cardiac patients for potential complications requires a thorough understanding of cardiovascular pathophysiology, keen observational skills, and the ability to synthesize clinical data to detect early warning signs. My approach is holistic, considering both the immediate clinical presentation and underlying risk factors. The first key factor is a detailed evaluation of the patient's vital signs and hemodynamic status. Close monitoring of blood pressure, heart rate, respiratory rate, oxygen saturation, and temperature can reveal deviations indicating complications such as arrhythmias, myocardial ischemia, or heart failure exacerbation. For instance, sudden hypotension may suggest cardiogenic shock, while tachycardia with a drop in oxygen saturation could point to pulmonary embolism or respiratory compromise. Electrocardiogram, ECG, interpretation is another critical aspect. I regularly assess for changes such as ST segment elevation or depression, arrhythmias, or prolonged QT intervals, which may signal myocardial infarction, electrolyte imbalances, or medication-induced abnormalities. A thorough physical assessment is equally important. I look for signs of fluid overload, such as jugular venous distension, pulmonary crackles, or peripheral edema, which might indicate heart failure. Cyanosis, pallor, or diaphoresis can point to inadequate perfusion, while new-onset chest pain, dyspnea, or palpitations are red flags requiring immediate investigation. Laboratory values are indispensable in assessing potential complications. I routinely monitor cardiac biomarkers like troponins and CKMB to detect myocardial injury, as well as electrolytes, renal function, and coagulation profiles, which can influence cardiac function and guide treatment adjustments. Elevated BNP levels, for example, are a marker for heart failure, while deranged renal markers could indicate cardiorenal syndrome. Another important consideration is the patient's medical history and risk factors, such as diabetes, hypertension, smoking, or a prior history of myocardial infarction or arrhythmias. Understanding these predispositions allows me to anticipate potential issues and tailor assessments accordingly. Lastly, I prioritize clear communication and documentation to ensure that changes in the patient's condition are promptly escalated to the healthcare team. By combining these elements, I aim to identify complications early and contribute to effective interventions, improving both the short and long-term outcomes for cardiac patients.
How do you stay updated on the latest advancements in cardiac care?
Staying updated on the latest advancements in cardiac care is essential for providing evidence-based, high-quality nursing care, and I actively pursue multiple strategies to ensure I remain informed and knowledgeable in this dynamic field. First, I regularly attend professional development courses, workshops, and conferences focused on cardiac care. These events provide valuable opportunities to learn about the latest technologies, treatments, and research findings from experts in cardiology. For instance, attending updates on advancements in heart failure management or innovations in cardiac catheterization techniques has significantly enriched my practice. I also maintain certifications such as Basic Life Support, BLS, and Advanced Cardiac Life Support, ACLS, and participate in refresher courses to stay current with the latest guidelines. Additionally, I seek out specialized training in areas like arrhythmia management, mechanical circulatory support, and postoperative cardiac care. Reading peer-reviewed journals, such as the Journal of Cardiovascular Nursing or Circulation, is another cornerstone of my professional growth. These publications provide insights into cutting-edge research, clinical trials, and emerging trends in cardiology, such as advancements in pharmacological therapies or minimally invasive surgical techniques. Engaging with professional organizations, such as the American Heart Association, AHA, or European Society of Cardiology, ESC, is another way I stay connected to the latest developments. Their online resources, webinars, and newsletters are excellent tools for keeping pace with new protocols and recommendations. In my daily practice, I also participate in interdisciplinary team discussions, case reviews, and quality improvement projects. Collaborating with cardiologists and other healthcare professionals provides valuable practical insights and helps integrate new evidence into patient care. I take pride in sharing this knowledge with colleagues to foster a culture of continuous learning. Finally, I leverage online platforms and e-learning tools that offer flexible, on-demand education tailored to healthcare professionals. This allows me to deepen my understanding of specific topics, such as electrophysiology or advanced imaging techniques, in a way that fits my schedule. By combining formal education, professional engagement, and self-directed learning, I ensure that I remain at the forefront of advancements in cardiac care, enabling me to deliver the best possible outcomes for my patients.
Describe a challenging situation you've encountered in the CCU and how you handled it.
One of the most challenging situations I encountered in the coronary care unit, CCU, involved a patient who developed cardiogenic shock following an acute myocardial infarction. The patient presented with profound hypotension, altered mental status, and evidence of pulmonary edema. The situation was critical, requiring rapid intervention and clear communication with the medical team. My first priority was to stabilize the patient while coordinating with the multidisciplinary team. I initiated advanced monitoring to assess hemodynamic parameters, including arterial blood pressure and central venous pressure, and prepared the necessary equipment for possible intubation and insertion of a central line. Recognizing the patient's life-threatening condition, I promptly started administering intravenous vasopressors and inotropes as prescribed to support cardiac output and improve tissue perfusion. At the same time, I closely monitored for signs of overcompensation, such as arrhythmias or excessive vasoconstriction, which are common complications of these medications. Communication was vital throughout this process. I maintained continuous dialogue with the attending cardiologist and intensivist, providing updates on the patient's condition and responding promptly to changes in the treatment plan. I also supported my colleagues, ensuring that tasks like blood gas analysis and medication preparation were carried out efficiently. Simultaneously, I remained attentive to the emotional needs of the patient's family. I explained the gravity of the situation in a compassionate yet honest manner, reassured them about the measures being taken, and kept them informed about the ongoing interventions. Over several hours, the patient's condition stabilized enough for transfer to the catheterization lab for further intervention. Reflecting on this experience, I realized the importance of staying calm under pressure, relying on my training, and fostering seamless teamwork. The ability to manage both the technical and emotional aspects of care in such a high-stakes environment reinforced my confidence and commitment to excellence in critical cardiac care.
What are your long-term career goals within cardiac nursing?
My long-term career goals within cardiac nursing are driven by my passion for advancing patient care, professional growth, and contributing to the broader field of cardiology. Over the next several years, I aim to build upon my clinical expertise, take on leadership roles, and actively participate in initiatives that shape the future of cardiac nursing. One of my primary goals is to deepen my specialization in areas such as advanced heart failure management, electrophysiology, or interventional cardiology. To achieve this, I plan to pursue additional certifications and advanced training, such as becoming a cardiac vascular nurse, CVRN, or obtaining an advanced practice degree as a clinical nurse specialist, CNS, or nurse practitioner, NP, in cardiology. This advanced knowledge will enable me to take on more complex cases and provide comprehensive care to patients with intricate cardiac conditions. In addition to clinical practice, I aspire to contribute to research and education in cardiac nursing. I believe in the importance of evidence-based practice, and I aim to participate in clinical studies or quality improvement projects that explore innovative approaches to cardiac care. Sharing my knowledge through mentoring junior nurses or teaching in academic or clinical settings is another area I'm passionate about, as I enjoy fostering growth in others and contributing to the development of the next generation of cardiac nurses. Leadership is another aspect of my career vision. Whether through roles as a unit leader, educator, or active participant in professional organizations like the American Association of Critical Care Nurses, AACN, I want to advocate for policies and practices that enhance patient care and support the professional development of nursing teams. Ultimately, my goal is to make a meaningful impact in the field of cardiac nursing by improving patient outcomes, driving advancements in care delivery, and serving as a role model for excellence and compassion in nursing practice.